Everyone, hello. So I'm doing this video really quickly because Tiffany had a really great question in the video under the post that I made about positions in the veterinary field. So her question was, would you have to be trained on anatomy and physiology for animals versus humans, right? She wants to know if that's something that is necessary in order to go after these positions. And the short answer to that is no, you do not, right? And so I'm going to show you that. So in the medical records for animals, they do not use like ICD-10 or CPT codes. They don't have like a universal code set that has been adopted across the board yet. It is something that has been in the talks and in discussion, but it is not something that has been implemented across the boards. However, they use the same medical terminology that we use for humans. And so, as you guys know, I have a fur baby. Let me take this down. I have a fur baby, and we utilize Banfield Pet Hospital for him. We have medical insurance and all that good stuff on our fur baby. So what I'm going to do is I'm going to show you guys what his medical records look like. And yes, my dog name is Cujo. All right, so let's go. So this is, his account and everything. Anyone who is familiar with using an EMR system, anything of that nature, some of this is just going to look very, very familiar. So as you can see, here it says view his medical records. So I could click in the view his medical records here. And this is just a list of his medical history. So anyone that has a puppy, you know that they have to go through vaccinations and everything like that. So our puppy went through vaccinations. He actually did have worms when we first got him. Apparently that's something that's very common in puppies. So he did have that and he had to get treatment for that. He actually had an ear infection not too long ago also. So, as you guys can see here, you see his medications. He has lab results here, his vaccines that have been done here. Okay, and just doctor's visit when we took him in when he wasn't feeling well, and we found out that he had an ear infection. So I'm going to show you one of his documents. Let's click on the most recent one. Gonna have to go over here into my files. Exam report, the date, okay, early puppy care. You see his doctor there. You see the visit, got the body weight and everything, the weight of his last visit. So they're keeping track of everything. Animals go through preventative care, okay, their diagnostic tests, right? So with animals, they just use the medical term for the diagnosis or the procedure performed. They don't use a code set, right? So as health information technicians, what we learn in school is directly transferable over into animals, okay? Into the veterinary field. What we learn could be transferred right over, okay? Diagnostic test there. Let's go down. Okay, so we see a list of his preventative care that was performed, the dates that he had all of these vaccinations. It's all in his medical records. It looks very, very similar to a human's medical record, right? Patient's name, the visit date, chief complaint. Sounds very familiar, right? You see that? What was performed during the care, all of that, his discharge instructions, okay? You see that? All right, so I just wanted to show you what his medical records look like, okay? Okay, so this is just an example of what the medical record for an animal looks like. There are many different animals that utilize the Banfield Hospital, from dogs, cats, and snakes, and all other kinds of things that can go inside of the Banfield Hospital. But in short, they just use the medical terminology, and it is very similar to the same exact terminology that we use for humans. All right, so I just wanted to show you guys this. All right.